Good evening, everybody. My name's Lynn Doherty and I'm leader here at West Berkshire Council. I'm joined this evening by, I'll let you introduce yourself.
Good evening, my name's Matt Spearce. I'm Head of Public Health and Wellbeing here at West Berkshire Council.
Back on the 16th of May, we held our first Facebook Live session all about our response to COVID. I can't believe it's 19 weeks since then, and there's been such a lot that's happened since then that it felt appropriate to come back to you and update you. We've obviously been going through our COVID response here in West Berkshire, and there's been an awful lot that has happened. I think last time we spoke about the work of the community hub and our brilliant volunteer groups across our district that have stepped up to help those in need. We've had lots going on, from food distribution to prescriptions delivered, and I would just like to thank everybody that has played an active role in that over the recent weeks and months. We've also been doing other things such as our active travel phases, which has been all about making sure people can go about their daily business while remaining safe and secure during these times. We've looked at reopening our high streets. We've put in place an outbreak control plan, which I'm sure Matt will be able to give you far more details on in a moment. We've looked after our rough sleepers. There's been an awful lot of work undertaken over the last few months, and I would like to thank everybody that has been involved in that work. I had hoped to sit here today and talk to you about the launch of our recovery plan, which we agreed back at an executive meeting on the 16th of July. We recognised that there were three key priorities here in West Berkshire when we started to look at recovery. They were education, health and our local economy. So this evening's session has originally been intended to talk to you about how we were progressing in each of those areas. However, as you will have seen through the national news, we're in a different situation, as we've seen increasing numbers of COVID cases nationally, and we felt it was appropriate for us to come back to you here in West Berkshire to give you the opportunity to hear direct how we are responding once more and how we will respond over the coming months. There's a lot been happening again, as you will have seen, with the things like new restrictions coming in, the rule of six, for instance, the 10 p.m. curfew on our hospitality industry, self-isolation law becoming in force today. So we felt it was appropriate to give you a chance to understand how that might work here in West Berkshire. There's a lot that we can talk about, and we're very open to any questions. So please do get onto your keyboards and let us know if there's any direct questions that you would like to know what's happening here locally in West Berkshire. We are going to confine this to local COVID responses, but it is our intention to hold these Facebook Live sessions every 6 to 8 weeks going forward, with particular topics that may be of interest to residents. I would ask you this evening to stick to COVID and our response. I'd also ask you to direct your questions in so that we can hear about them. And with that, I'll leave it open to you to come forward to us with questions. Matt, is there anything you'd like to add?
Just to really build on to what Lynn was saying, I think this has obviously been quite difficult times. I think back in March we didn't know much about this virus. It was very new. We've learned a lot since then, and we've come a long way. Particularly over the last 3 to 4 months, we've been doing a lot of work on our local outbreak control plan. So this really has been about working together all across the council with our partners to prepare for the next few months. We know the winter's going to be challenging, but we know that we have good plans in place, not only to prevent outbreaks and people getting COVID in the first place, but also to respond to outbreaks if they occur across West Berkshire. So we feel we're in a good place, but we know that everyone needs to play their part. The key messages still remain for all our residents in West Berkshire, which is about hands, face and space. So ensuring we wash our hands regularly, ensuring we cover our face where we need to, and then ensuring that we keep social distancing from those around us if needed. So I'm happy to take any questions that people might have.
We don't have any at the moment, so we're just going to watch them
Okay.
for them as they come in.
Well, while we wait, it may be worthwhile talking a little bit about some of the work that's been going on over the summer. So obviously we've done a lot of work with our schools in West Berkshire on the continued opening. So we had schools open throughout for key worker children and for those that were vulnerable, but over the recent months our schools have been opening up, and I was really pleased that when we started back in September, the majority of our schools were back very quickly. I think it's quite a worrying time for all parents, and I'm a parent myself, because obviously you're concerned about your child's education, but you're also concerned about the potential outbreaks of COVID that we hear in the news. So I'd just like to thank everybody for their support in that, but particularly to thank our teaching staff and support staff in schools for enabling that to happen, because I was very conscious that there was a huge amount of guidance coming out at very short notice sometimes, and I think it's real credit to the teaching staff here in West Berkshire who have actually enabled that to happen. I actually got some attendance figures last week, and while I don't want to give them directly, we were well above the English average for attendance, so I think that's a really plus for us here in West Berkshire.
We have one question from Paula, who said, how are the care homes faring? Are they prepared for this spike?
Let you go on that one, Matt.
Yes, I think we firstly acknowledge that it's been a really challenging time for care homes, as it is for some schools now, particularly during the first wave of the pandemic. And we recognise how difficult it's been for those in those care homes and also the relatives in terms of their ability to see their loved ones. So there's been a lot of preparatory work in terms of planning for an outbreak, ensuring sufficient infection control measures are put in place for care homes, so staff have the appropriate training. Where there have been incidents and outbreaks in care homes, some of our staff across the local authorities have worked with care homes to identify how their policies could be improved. We've also worked with care homes to set up visiting policies to make sure it is safe for those care homes that do want to enable their relatives to go and see them. They can do so safely. So we feel that care homes are still a really key priority for us in West Berkshire. We know they're incredibly vulnerable, and they were affected massively at the start of the pandemic. So we certainly feel we're better prepared now, and we're continuing to work alongside our care homes as required.
Thank you. I have another question from Gary, who said, many restaurants seem to still be cramming customers in, such that social distancing is not happening. How are you dealing with this?
Well, we've obviously got our Public Protection Partnership, which is a partnership that works across Reading, Wokingham and here in West Berkshire, whereby we have in place our environmental health officer team who have been working alongside businesses to make sure they are COVID compliant. We've got lots and lots of guidance that they have to adhere to, and certainly I've been out and about in Newbury and I've been really pleased and found it a very positive experience being out in our hospitality industry. In fact, I was out on Friday night and I was impressed with how much they were adhering. But what we would say is, if you're finding a situation where they're not adhering, if you let us know, then that's something we can certainly follow up on, because I think it's a really difficult time for our hospitality industry, and we really recognise that and want to support them to enable them to continue to open safely.
It's just worth adding that there is now companies are legally obliged now to ensure that people socially distance within their premises, alongside track and test and trace details, and also using the app and a QR code. So again, if you identify that issue and that situation in a facility, then please do let us know, and we can certainly follow that up.
Thank you. Have a question from Claire, who asked, is there any contingency plan for GCSE/A-level exams this academic year if needed?
It's a very topical one. I have a son who's due to do GCSEs this academic year. No, we haven't yet heard what the measures will be. I know that some schools are looking at a reduced curriculum, but that's still being under discussion. So we're still waiting for guidance on that. But I do know that schools are working really hard on catch-up programmes and offering assistance through online learning as well. So we will keep you informed as we hear more. We will be letting the public know.
Then we have a question from Elizabeth. Do you have plans to check that schools are following COVID guidelines, re-cleaning, hand washing in school toilets, enough gel, social distancing? Can you help schools to help encourage parents to social distance at pick-up, drop-off times?
Yeah, I can pick this one up. So no, that's a really good question. And again, our local outbreak control plan involves all the service leads across the council working with settings, whether it's care homes, workplaces, schools. So schools in particular and we've been doing a lot of work, our health and safety team, to review the risk assessments of schools. So reviewing what schools have put down, what measures they will put in place, both to prevent and respond to an outbreak. So we've done a lot of detailed work looking at those. And funny enough, actually, I've got a meeting with all the primary school head teachers tomorrow morning, just to further those conversations about how they can ensure their schools are COVID safe. So no, I think, again, there's lots of work going on with schools. And again, if you identify particular issues, either raise it with the schools themselves, or alternatively, you can contact us and we can work with those schools to help them think about how they might be able to make their schools more COVID safe.
And I would just add to that with regards to parents and pickups, etc. We did do a leaflet last week which has gone out to all schools, which is a reminder for parents. So it was to go in school book bags and to be issued to all parents around the COVID requirements. And again, that whole reminder around making sure that we do hands, face, space, and encouraging people to keep safe through social distancing. So that went out last week as a communication to all parents.
Then we have a question from Bethan. What about people who are struggling to access the COVID tests to get back to work and their children back to school?
Okay, yeah. Firstly, I sympathise with individuals at the moment in trying to get a test. I'm sure many of you watching are familiar with the challenges in terms of accessing a test across the country at the moment. And those challenges exist in West Berkshire as well. So what we do know is that if people do persevere and they keep trying to get a test, you do tend to get a test eventually. We recognise it might take a bit longer than anticipated, but you should be able to get a test if needed. What we do try and stress is only those with symptoms that do need a test, but it's so important. If you do have symptoms, you do self-isolate and then contact 119 or go onto the NHS online website to get a test. So the challenge, just to reiterate probably, is it's not necessarily the testing capacity, it's the labs to actually process the swabs. So yeah, like anywhere else, we're having our challenges, but we're working with our national partners to try and improve access as best we can.
Thank you. Then we have a question from Valerie. Do you have additional help for business owners for the next 6 months? I worry many won't make it if we have another full lockdown. Will you consider free parking again?
We have been doing quite a lot with our business, our local businesses. So I'm sure you will have heard we had about 29 million at the start as small business grants, which we distributed very quickly and very effectively here in West Berkshire. I know that there's different schemes coming out all the way. We heard the Chancellor's winter plan only last week. So I appreciate that we've got furlough coming to the end, but we have got the job support scheme kicking in from the 1st of November, which will replace that furlough scheme. We're also looking at an extension for self-employment extensions. So there's a lot of national initiatives going on, as well as the VAT cut for particular industries such as hospitality and tourism. I mentioned that already, and we know that they're facing difficulties. And I also understand that the loan schemes have been given more flexibility. So there's certainly national schemes out there, and then our own local economic team here in West Berkshire Council is working hard on the ground to try to make sure we understand and meet and support their needs. So we've been working with the Economic Development Company, and we've been working with Local Enterprise Partnership to understand where that help is most needed to be directed. With regards to parking, it is not something that we're currently considering. There's many reasons that I could sit and go into here, but I don't feel it necessarily addresses the question other to say we won't be considering free parking.
Right, so they're all the questions we've got in at the moment.
I think it might be worthwhile, just while we're waiting, to talk a little bit about mental health. Throughout this, we've been concerned around individuals' isolation and the impact that this anxiety might be having on their mental health. I've been really pleased. I've been closely involved with Emotional Health Academy throughout my time here at West Berkshire, and I know they've been offering a lot of support to young people with mental health difficulties. So I'm really pleased that their work is continuing. But actually, Matt and I were both at a health and wellbeing board last week where we signed up to the Mental Health Prevention Concordiate. Matt, I don't know if you want to talk a little bit about what that will actually mean for residents here in West Berkshire.
Yeah, I can do. I mean, I think just like Councillor Doherty was saying, I think we recognise that now in particular, mental health has always been a challenge, to be honest, but we also know that now people are feeling anxious, scared, lonely even. So last week at the Health and Wellbeing Board, we made a commitment for all our partners, the NHS, the council, the voluntary and community sector, to work together in recognising that mental health is an important issue, as well as physical health, and that we want to do more to improve the mental health and wellbeing of our residents. So I think really we recognise there's already lots of good things going on, and what we want to do is connect people to those services, activities that can support people with their mental health and wellbeing. There's probably too many to list, but if you go onto our website, there'll be lots of information on there that people can find. In particular, we support something called Every Mind Matters, and there's some really good resources that people can look into. They can sign up a personalised plan, think about what things might help with their mental health and wellbeing. And we've also commissioned things like a new befriending scheme across the council as well, which can connect people who are lonely. So there's something for all ages, I think, that can be found on our website. And I think it is so important, particularly as we enter the winter months. It's going to get darker nights. How can you connect with friends and family? We already know that using MS Teams and Zoom has been really beneficial, but it is important to keep that connection up, particularly, as I said, as the dark nights creep in, and it can just feel that little bit lonely.
Yeah. So we would encourage anybody that's struggling to come and find us the details on the website, so don't feel you're struggling alone. I'd also say something around economic hardship as well. If you're struggling through economic hardship, it's also worthwhile coming on to the West Berkshire Council website, where there's some information about how you can contact us for help. So we've been really keen throughout this pandemic to make sure that our communication channels have been open and varied. So our website here at West Berkshire Council has details for both residents and businesses. I would urge everybody to come and have a look at them. The other thing that I would urge you to do is to sign up for the council's new newsletter. So as an emailed newsletter on a weekly basis, and it's just a great way of communicating out exactly what we're doing, so that you've got that picture of what's happening here locally and how that might differ to the national picture. So please, take the time to subscribe to that newsletter, and that will be a great source of information for you going forward.
We have a question from Alice. As winter is coming, how can you differentiate flu with COVID-19 symptoms? Where can you get more information to help differentiate?
Okay, thanks. Alice, that's a really good question, and one we're getting a lot of, particularly from schools. Again, on the NHS website, there's a really good page on there, which I'm happy to share, about how you can differentiate between flu and cold. Generally, what we are advising people to do is follow those 3 symptoms that we know are most associated with COVID. So that's a high temperature. And when we mean by high temperature, we don't need to record the temperature. It's just that hot touch test on chest, a persistent cough, and I've forgotten the other one. I've forgotten the other symptom: temperature, cough, and sorry, my mind's gone blank.
Oh, sorry.
I do apologise. I've been talking about it for the last 6 months. So if you look at those
Loss
symptoms,
of taste and smell.
Taste and smell.
Sorry, I had to get my head in gear there as well. Sorry, Matt. Loss of taste or
dear.
smell.
So yeah, if you any of those 3 symptoms, and it's just one, it's not all 3. And we've heard that some people think you have to have 2 or 3. It's actually any one of those symptoms, then you must self-isolate along with your household contacts. So and then seek a test. And until you've had that test and been told that you're negative, you have to assume that you've got COVID up until that point. So that's really how you differentiate between COVID and flu. But we recognise there are similarities, and I guess it's probably worth pointing out at this time that if we are talking about flu, if you are eligible for the flu vaccination, then it's really, really important that you get that vaccination, because the challenges that we might have is there could be a flu pandemic on top of a COVID pandemic, and we really don't want to go down that road. So really important, please do get your flu vaccination if you are eligible. And again, there's more information on the NHS website.
No questions at the moment.
Okay. The other thing it might be worthwhile talking about a little bit is the new law to self-isolate that's come into force today, and how we will operate that across the district. I know it's predominantly enforcement coming through from our police teams, so we will be keeping you informed on how that will look across West Berkshire, and I think we'll probably be looking to do something in our weekly newsletter on that if that situation changes. I know there's been talk about COVID marshals, and we haven't yet decided how we will operate that here in the district. I think there's areas that have far higher numbers where they have been prioritised, and certainly to start with, the priority was those areas. We do know that there's funding coming, but we don't know the exact details yet. Once we have those details, then we will be looking at how we can best operate that here in West Berkshire. I think that would be fair to say at this point,
Yeah,
Matt.
absolutely. Yeah, we're waiting for more information on COVID marshals, but I think they've been successfully used elsewhere across the country. But as you say, the government at the moment are really focusing on those areas that have high incidence of COVID-19. And compared to West Berkshire at the moment, we fare relatively well. Although, as I said in the opening statement, there are a slight increase in cases which we need to be mindful of.
Okay. The other topic that came up last time, and I think it's probably worthwhile just letting people know, was concerns around our rough sleeper cohort, particularly as we've all felt the chill in the weather change, and we can feel the autumn weather coming, and how our normal operations would be throughout winter. We were really pleased last week to receive an additional £184,000 of funding, and that funding is being used to help transition those that we took all of our rough sleepers off the streets, and we put them into hotel accommodation and B&Bs, and we're now looking at transitioning them on to move on accommodation. So we're trying to keep them off the streets and move them on to suitable accommodation, and that money is going to be really useful to enable us to do that. And I'd just like to thank, there's a homeless working group of partnerships that come together and have worked really hard on making that happen. And I'd just like to thank everybody that's been involved in that, because I think it's been one of the success stories. We've talked about the impact of COVID an awful lot, and we've tried to look at where we've got some positives out of that. And I would say that actually the work that's been done with rehousing of our homeless has been a real positive here in West Berkshire.
We have another question from Alice. How are you sharing information to those who have no internet connection?
Well, I can talk quite a bit at length on this, because we've been looking at this through our whole communications plan, and actually we were really conscious of making sure that it wasn't just totally internet enabled. So hopefully most residents would have received 2 official leaflets from us, one right at the very start, and I think I talked about this back on the 16th of May, about how to get help, and it gave details around our community support hub, and it also gave a telephone number, so that it wasn't just purely web based, it was a telephone number system as well. So we put one of those leaflets through everybody's door. And then as we developed our outbreak control plan, and were conscious that we would be responsible here on the ground in West Berkshire for controlling the virus going forward, we've put another leaflet through everybody's doors, I think it was at the start of September, with further information. And again, there's telephone numbers on there, so that it's not just web based. We've also been working with our towns and parish councils to make sure that there's posters that have gone up that give people that information as well. So we're conscious that we cannot just be internet based, that we need to make sure we're reaching out to as many people as possible. And I think, there's some really positive examples of that. I've done some radio interviews, for example. I think, Matt, you've done some radio interviews, so that, we can make sure that people aren't solely reliant on the internet.
Yeah, I'll just add, there's a little bit more on that. I think we've also started to meet with community champions. So we have some really active and enthusiastic individuals that have been really supportive throughout this pandemic, based all around West Berkshire and villages and towns. So we've been meeting recently with them to think how we can put up posters on parish boards. I think there's also something in the Newbury Weekly News, as of this week or last week, I can't remember, also just encouraging residents just to socially distance, wear face masks, to seek a test. So absolutely, we're trying to kind of use a whole range of different platforms to reach lots of different audiences.
Thank you. We have a question from Nick. The government announced the plan to give bicycle users a £50 repair voucher at the start of lockdown. Unfortunately, the scheme has been oversubscribed nationwide. What are your thoughts around increasing cycle usage in the district?
Thank you for your question, Nick. I should have said at the start, if there's anything we can't answer, we will take your details and come back to you. But this one, we've actually been quite good at using our active travel funding. So I know we've encouraged the use of that money along the A4, for example, making that cycle lane mandatory. And I think it's where we can ensure safe interaction between both cyclists and motorists, we've been doing so. So there's quite a bit on the first phase of the active travel scheme that's been done, but we're actually just waiting the results of our second phase of active travel, which will again look at additional space for bikes on our roads. So you should see details of that coming. I was particularly pleased to see that we're actually putting in more cycle shelters with winter coming, because we want to encourage people to continue to use the bicycle even through the winter. So I was particularly pleased that some of that active travel fund is going into new shelters. I think it's in Hungerford and Newbury, and I think it's somewhere in the east as well, but I can't quite remember off the top of my head.
Did one of my questions come to me? Somebody in public health. I'm a clear advocate of active travel. So I guess from a public health perspective, cycling is probably one of the best ways, while walking as well, is one of the easiest ways to embed physical activity into your daily life. And we know that physical activity is one of the most beneficial things people can do for their health and well-being. Some people have called it a miracle drug, so I think I'm certainly supportive of it. And again, if there are opportunities for people to get out and about, walk and cycle, then I'd very much encourage to do so. And that also links to mental health and well-being, because we know the evidence is extremely strong that if you do some physical activity, it improves your mental health and well-being. So I'm certainly a strong advocate and encourage as many people as possible to do more physical activity.
And it looks like that's all the questions that we've had come in so far this evening.
Okay. Was there anything else you feel we should cover at this point, Matt?
Nothing comes to mind.
Okay, well, we hope you find these sessions useful. We're more than happy to do them. It just gives you an opportunity to come direct to us with questions, and it's a really easy way for us to directly communicate with you. So very happy to do these, and we'll be looking at programming them in again, but we won't keep you any longer, because I'm sure there's lots of other things you'd like to do on your Monday evenings. So thank you for those that have taken the time out to join us, and we hope to see you again for our next session. Thank you.
Bye.